Case scenario summary of the 54-year-old man and the medical complaints, which is that the patient complained of dizziness along with headache and the ringing sensation in the right ear. Symptoms began 3 weeks ago, which it has been getting worse, and the dizziness causes difficulty in maintaining balance while walking. And his medical history, to, which is that he was diagnosed with classical migraine 10 years ago, and he was successfully treated with sumatriptan. This is a medication used to treat acute migraine or headaches in adults. And then the family history: the mother died from pancreatic cancer, father died from cardiac arrest, and there's no neurologic disease in first degree relatives, but the first cousin died of glioblastoma. Now the question: why do you think certain patient demographics such as age, race, gender are important to include in a medical case summary? Now, including patients' age, race, and gender in a medical summary is crucial for several reasons, and one of them is personalized. It boosts personalized care, or it improves personalized care. Now, certain diseases may be more prevalent in specific age groups or racial backgrounds, and some medications may work differently based on gender. And the next one is accurate diagnostics. It improves that too, because some conditions may be common in older adults, while others may be more prevalent in certain age or ethnic groups. And lastly, it improves effective treatment plans. Knowing a patient's age and gender can help in selecting the most appropriate dosage. Now, choose three terms from the scenario to analyze and break down. Now, the first term is pancreatic, and the word root there is pancreat, which means pancreas, while the suffix is the ic, which means pertaining to, and when you bring them together, which is pancreatic, means related to the pancreas or relating to the pancreas. And the second one is neurologic. Neuro or nerve is the word root there, while the O is the combining vowel, and the logic, which is the suffix, means the study of or to study. So neurologic means the study of nerves. And the last one, rhinitis, which is rhine or nose, and that is the word root, and while the itis is inflammation or disease, that is what it means, and that is the suffix. And joining all words together, rhinitis means inflammation of the nose. And the third questions: review the scenario and highlight any abbreviations used in the case. Some of the abbreviations used is MR1, which means magnetic resonance imaging, and BP, which means blood pressure, and LS spine, which means lobosacral spine. And number 4, for this scenario, which of the following is most likely diagnosis? Um, acoustic neuroma is the most likely diagnosis, and this is simply because, based off on examining the patient's medical history and his current sign and symptoms, all the conditions experienced are very similar to the symptoms of an acoustic neuroma. Example like that of the ringing of the right ear and the problem with dizziness, which results to an issue of balancing, and the hearing loss. So all these are symptoms that is experienced by somebody who is diagnosed of acoustic Neuroman? And lastly, how do you see medical terminology contributing to the overall integrity and professionalism in healthcare practice? For me, medical terminology is very important to healthcare practice for so many reasons, and I am positive to I am positive that it will go a long way to contribute towards the overall integrity and professionalism in healthcare practice, especially in areas of professionalism. For example, medical terminology improves precision and clarity as well as consistency amongst healthcare professionals by ensuring that everyone involved in patient care understands the diagnosis, treatment, and medical procedures without any ambiguity. And while in areas of integrity, medical terminology contributes to the improvement of medical coding and billing, and this is very essential for accuracy, thereby reducing errors and delays in reimbursement.